FM, The Source.
I'm not so sure why we have that as bumper music.
I don't know, but it sounds good.
Our next guest is Dan Pelino. He's an innovator, a thought leader, which is what I want on my business card, thought leader. Mm-hmm. He's a contributor to CNN, the BBC. He's an adjunct professor at Western Kentucky University. His book is called Trusted Healers, Dr. Paul Grundy and the Global Healthcare Crusade. Let's find out about the book from Dan Pelino. And I'm not so sure why we had that bullfighter music or whatever. Dan Pelino, good morning, Dan. Thank you for waiting through the commercial break there.
Yeah, my pleasure, Larry and Robin. Thanks for having me on.
You're welcome. Where are you calling from?
I'm calling from Northern Virginia, just outside of D.C. today.
See, I was so hoping you were going to say Mexico, because then it would have made sense why we had that music.
I don't know. Given everything that's happening in this town, maybe, in fact, it's appropriate.
There you go.
Okay. Well, yeah, so what is the book about? Is it a way to help me understand where I should go and who I should trust for my health care?
Well, actually it is, and it has three tenets to it. One of them is about your own health care and what you should look for in a medical home. What is a medical home? Why should I go there? What should I look for? Questions I should ask my doctor. We also look at societal change. How long does it really take to have something take hold? You know, we've got Medicare and Medicaid, and that started in 1965, and the original plan was actually have that age drop from 65, and it never has. So there's a lot of discussion going on right now about what we should do with Medicare and Medicaid and the conversation. And then last but not least, we do look at leadership models. People that did great things in healthcare, and what can we learn from them? And we follow the path of Dr. Paul Grundy that Time Magazine calls the godfather of the medical home while we travel around the world looking at the best performing health systems.
Oh my gosh, that's a great part of what I want to hear about. Tell me about the ones that are working, because shouldn't we be patterning what we do after the ones that are working, or do we have the best one? I don't think the answer is yes to that, but I'll throw it out there in case it is.
Well, to be honest with you, the answer is yes to that in one way, and that's specialty care. The United States has the best specialty care in the world. It really started in 1911 with something called the Flexner Report, where we asked medical schools to spend time on biosciences, medical sciences, and then get hands-on training and pick a discipline. And so we, over the last 100-plus years, have just been spectacular in specialty care. However, you can tell where I'm going here. We kind of left out the comprehensive care, the family care model. And when you look at other countries and how they perform better, they do far better with primary care and creating medical homes. As a matter of fact, we only spend about 5 to 7% of our dollars on health care, on primary care. They more than double and triple us at 14 to 20%. And that's what we talk about in the book. How do we move from sick care to well care?
You also have interviews with different specialists in the field that are very insightful.
Yes, we do, including Dr. Mike Roizen, who most people think of as the enforcer around well care. Oprah Winfrey called him the enforcer. He's from Cleveland Clinic. He's written 15 books. 4 of them are bestsellers. Most people know him for Real Age, but he talks about what you have to pay attention to in order to be well and avoid chronic diseases going forward.
So in the specialty care part of the conversation, I just want to go back to that for a second, because I'm curious if we have the best in the world, but is it only available to those who have the money to pay for it?
Well, that's not true.
No, okay.
We end up paying for it one way or another because the way our healthcare system is set up. We don't deny coverage to anyone that shows up in an emergency room or needs that. Unfortunately, then that comes back to all of us and paying for it in the system. So that's why it's so much better for us to try and drive our attention towards primary care and well care. An emergency room visit's about $3,000 to $4,000. A primary care visit's $170. And if we can start to get in front of the care, not only is it better for people, but it will cost less, and we will hopefully take take the burden of society of giving care to those people that really can't afford it, that get mixed into the system, by addressing it with primary care up front.
Well, you also have cities in there like Flint, Michigan, because of the problems they've been having, as opposed to cities that have not been having problems about their health care.
That's true, and some of those things that have happened around water and other things that are natural resources are things that need to be addressed. I don't go into it too deep, but I do call it out as things that need to be done right. And when I look at cities that have done a much better job of it, Rochester, New York is one that we dedicate a chapter to, and how they've rebuilt that city around better health care.
Earlier in the interview, you mentioned a word or a phrase that I didn't exactly know what it meant. Medical home. What do you mean by a medical home?
Yeah, thank you for that. So a medical home is something where you have 7/24 access. You can get an appointment that day. They know about you, and there's a team care model. The lab results come directly back into that hospital system. You have a system that navigates your care for you, as opposed to having a single doctor. To use an analogy, a single doctor office may take you a while to get an appointment. Probably everyone that's listening to us has been struggling with that at one point or another. But if you're in a medical home, a patient-centered medical home, you can call and get an appointment immediately. It may not necessarily be with the doctor that you're used to, but there's someone that knows you, your information's there, and they can see you right away. They call you in for your mammogram, colonoscopy, right now for your flu shots. Could be shingles, other things like that. Noticing what your care needs and makes it well.
So is it just a new way of thinking about a hospital, or is it smaller than, I mean, physically?
Yeah, it's really not it's not a hospital per se. It's more about primary care. It's about the front end of care, as opposed to a hospital system. So yes, it's more about primary care on the front end of this, and the doctors that take care of you and kind of quarterback your care for you.
And who is using this system? Are anybody in this country, or where would we find the system, the medical?
Well, many of the integrated delivery systems are starting to build this out. 70% of all CEOs that run these kind of delivery systems are paying more attention to creating the patient-centered experience. They're also hiring more RNs and PAs, family nurse practitioners. They're bringing in nutrition into their practices. Some of them bring in sleep patterns into their practices, trying to treat you holistically.
Yeah.
This would include mental and behavioral health as well as your physical health.
And also, too, the families. Sometimes they have problems getting insurance for all their family members, and the greatest concern is coverage for the children.
Well, that's certainly true, although I don't get into how that would be paid, but there's different ways today that people can put their children on plans, and of course we've got certain regulations that allow children to be part of parents' plans going forward, but that is something that we need to continue to address. And I think a lot of the insurance companies are going to figure out best ways to increase coverage. We know that access for all is the important first step in having a healthy society.
Yeah. You know what? It almost sounds like the 21st century version of the house call, where the doctor would come to your house. I mean, if we can go to another place, but it's the same kind of care as if they had come to us, that's a good thing. Because the doctor that used to come to the house when I was a little boy knew everybody in the family, knew me, knew my mother, knew everybody.
You're so right. For my family, it was Dr. Spector, and he knew everything. And I still remember going to his office and seeing the fish tank, and the nurse that would come out and beckon me back for my shots or whatever. Absolutely. But we're now talking about a system of care, and we're moving from what would have been an individual. If I gave you an analogy, it would be like a cowboy that would ride in, knock on the door, look at your folder, and then say, "Hi, Larry, it's nice to see you again. How have you been?" Versus a team care model like NASCAR. And we are in the race of our life, and we're the car. And when we have to come in, they call us in and say, "Larry, it's time to come in for an appointment. You need your shots," etc. And when you pull in, there's a pit crew versus a single cowboy or
Oh my
cowgirl
gosh,
to handle it.
it really sounds like a perfect idea. I'm not the only one thinking that, by the way. You've got every single reviewer of your book giving it 5 stars, really good positive things to say. I'm looking on Amazon, by the way. And I think you did. You sent us a book, so for a listener, if you call right now, I won't be able to answer it because Dan is on the same line. So just wait till we say goodbye to Dan. You can call, and I'll just take one at random and give you the book we have. But you can buy your own on Amazon. And Dan, do you have a website you'd like to direct us to?
Yeah, absolutely. www.trustedhealers.com, the name of the book, and that'll direct you right to my website. And on this Thursday, Dr. Oz has invited myself and Patrick Kennedy to tape a show that we think will air the 29th of October. So we're hopeful to get the message out to more people. And if we help people to know their rights, know where to go, maybe we can just save a life.
Very good. And if I could use the Mexican music now, just say, don't cross the border. It's not necessarily better over there. If I can squeeze in one quick question, what about the imported drug issues? What do you think about that?
Well, I certainly know why the prices are different. In the Canadian system, is a single system, so when you sell the Canadian system, it's less expensive. And in the U.S., we sell individually into systems, and so there's some price changes there. And there's ways to address it, but yes, there are lower prices when you go into Canada, and there's some economic reasons for that. Much longer discussion, but you're right to ask the question.
Dan, thank you again. The book is called Trusted Healers, Dan Pelino. The author on the cover is Bud Ramey. I just mentioned the second author.
Yeah.
Thank you, Dan. Thank you for doing this. Good stuff.
Yeah. Thanks, Larry. Thanks, Robin. Have a great day.
You're
Good
welcome.
help.
We'll be right back.
Career Source, Citrus, Levy, Marion brings together business and community partners, economic development leaders,